To labor matters now. Resident doctors in the Federal Capital Territory have insisted that the ongoing indefinite strike will continue despite the partial payment received from the federal government. The president of the association, FCTA Chapter, George Ebong, on Wednesday said some doctors who had been owed salaries in training funds had finally received payment after years of waiting. According to him, 28 doctors who had been owed salaries arrears ranging from 1 month to 1 year for over 2 years were paid on Monday night. He added that payments had also commenced for the Medical Residency Training Fund, the MRTF. Of the 150 doctors owed, 103 had been paid, leaving 47 without their entitlements. Now I'm joined by Dr. George Ebong himself, president of the resident doctors in the Federal Capital Territory. Thank you very much, doctor, for joining us.
Thank you very much for the invite. Good evening.
Yeah, no, you're welcome. Good, doctor. So the FCT administration says it has approved payments of your arrears and implemented some of your earlier demands. Yet doctors remain on strike and hospitals are still not running at full capacity. So if these approvals have been made, what exactly is still holding things up?
Thank you once again. So we have always had this problem of trying to fix these problems once and for all. And each time we try to fix it, we always go back to where we were the first time. Recall that 6 weeks ago, we suspended our strike because the Senate intervened and the minister also approved. He made the pronouncement in public that is approved, and it took like another strike for us to even see just 2 of those approvals implemented. So that's the problem. So there's an approval, there is an implementation, and it takes a lot of time. Whatever is in between, we have no idea. But if you've owed people for that long and you've made some approval, I think it is just very important that the implementation is done as soon as possible so that the workers can have faith in the system. Right now, we don't have faith in the system, and that is why, even though there are trickles of payments, but because we know it has been a history of when they start paying, they expect us to suspend the shutdown, and when we do, then they stop every other payment.
So doctor,
that is why the Congress is not.
So doctor, sorry to butt in, doctor, but in all of this, I wanted to. There's so many questions I need to ask you. In all of this, has a timeline been given by the FCTA?
And that is the problem. We even gave them a timeline so that we could work together with a timeline, but they don't have a timeline for us. They just tell us they're going to do something. Give us a timeline so we can take this information back to the Congress. They don't have a timeline. So it's like a blank check, and that is not something the Congress is going to accept as a working document.
So, doctor, it's not the first time that we've had doctors down their tools. There's been many issues, some of them regarding wages, if I'm not mistaken. Well, mostly about wages, poor working conditions. And each time there's an agreement, there's always a relapse by the stakeholders here. Now, what exactly needs to change in how the FCTA handles staff welfare to stop the cycle from happening again and again?
They need to learn that when they have an agreement with doctors, for example, or nurses or pharmacists or workers in general, they need to learn that they have to be truthful and trustworthy. They have to earn that trust. So the next time they say, you know what, go back to work, we're going to do this, people can believe in them. So all along, these arrears have accumulated because each time they tell us go back to work, we go back to work, and then they betray that trust. And that is why you see all these arrears are just there: skipping arrears, promotion arrears, post-part 2 conversion arrears, salary arrears, you know. So it's been there for those years because we believe all the time in them, but they actually don't actually do the things they said they're going to do. And that is why, let me give an example. Like now, the hazard allowance has been there since 2021. And this present administration doesn't see the need to pay because they feel that it wasn't during their time that hazard allowance owed. So you can see the complication now. But then government is continuum, okay? Now, when we owed this money in 2021, because we believe in the government of that time, they told us, you know what, go back to work. We're going to pay you this money. And this is 4 years now. They've not paid that money. And we know that the value of that money then and the value of the money now is totally different. So we are tired of always being the one that are being shortchanged all the time.
Okay.
And that's why we're saying, do all the demands and then we'll suspend the strike.
Okay, then, Doctor, also one of your demands is not just about money. It's also about staffing and infrastructure. Talk about overcrowded wards, updated equipment, and also shortage in personnel. So since the last round of talks with the FCTA, have there been any visible improvements? Have there been new hires, renovations, or better equipment? Are hospitals still operating below standards?
Below standard, even though the minister actually said that it was going to phase hospitals soon, and we really want to believe in what he said. But for now, nothing has been done.
So like it or not,
That works, but implementation, no.
okay. Well, Doctor, whether you like it or not, strikes, they take a toll on patients. People lose loved ones during these strikes, and the public begins to lose faith, just like you've lost faith in the FCTA, but they lose faith in the health system itself altogether. Many residents feel trapped between the government delays and also doctors who withhold their services. And there is that thing about the theocrat, what's it called again? The doctor's oath. So how do you balance your members' legitimate grievance with your duty to patients? And what message do you have for the FCT residents now who are caught in between this fight?
Thank you. So the problem now, in as much as we are actually supposed to save lives, we are also actually supposed to do no harm to our patients. And I will tell you, because of the unfavorable working condition and the severe shortage of manpower, the doctors are actually beginning to cause harms on our patient because of mental fatigue, over-labored working hours, and etc. So I think it's even better that we don't commit unforced errors on our patients' health just because we want to try to do what we can't even do because we're tired. We're humans, and sincerely, we can't give what we don't have. When you have a doctor who will run 3, 4, 5 wards, who will be in the hospital for 2, 3 days, a doctor who will do like 7, 8, 9, 10 cesarean section a day, I think that is not even a good practice on our patient. In fact, that should amount to medical quackery when a doctor will be doing like 10, 11 CS a day. That is very, very unprofessional.
Dr. George, I want to say thank you for joining us tonight to have this conversation. We do hope that this situation clears off, well, hopefully before the end of tomorrow. We'll continue to follow the story, and of course, we always have you as a resource. Thank you, Doctor.